And welcome back to the Commissioner's Report. Joining me now is Commissioner Ed Smith. Commissioner is with the District 3, and we're going to find out more about that in just a second. And as you can see, we've got the doctor in the house because we're going to find out about take the pulse of Polk County's healthcare system. Dr. Ulyee Choe is here. He is the Director of the Florida Department of Health in Polk County, where he's been there since May of 2013. Gentlemen, thank you both for being here.
Thank you.
Commissioner, let me ask you about District 3, because it's interesting. A lot of people may not know where all the districts are. And what's interesting, when I look at a map of District 3, you're the only district that's completely inside the county. There's no outside county borders. That's kind of interesting.
Absolutely. Well, we are in the center of the county. I guess you can call us the heart of the county. I like to say it that way. And as you know, there are 5 commissioners and 5 districts. Now, we have to all live in our district, but we run county-wide. So, you know, it's just, I think the forefathers of us here had us live in the districts and had the district divided up to make sure that all of us didn't live in the same city, which would probably not be a good thing. So that's why we're divided out that way. Now let me tell you where District 3 is.
Okay.
I'll try to give you the boundaries as best I can. Starting at the north at Polk City, and then I go over to US 27, and from there headed south, and so I include the western part of Haines City, the part west of 27, Lake Alfred, the western part, or I guess the western, probably 2/3 almost of Winter Haven, Eagle Lake, and then I go back up and just skip right across the southeastern corner of Lakeland. And so you can kind of get a basic idea of where District 3 is.
But as you said, you are literally in the heart of Polk County.
We're in the middle of it all, yes.
Well, obviously we're not here to talk about boundaries and maps, even though that is interesting and some more background about you. But we want to talk about the state of the healthcare here in Polk County. And I know this is important for everyone. Their health it's what you have that might be most important to an individual. But the county certainly has a role in providing and protecting people's health. And Commissioner, why is this so important for you when we think about healthcare here in Polk County?
Well, you know, the big issue here, of course, is the unserved and the underserved in the great healthcare scheme of things. We do have some organizations that fill in there, and Polk County, of course, has our indigent healthcare program. But, you know, in my mind, the really, I guess, the staunch supporter of all that should be the Polk County, Florida healthcare system. And that's where it is, and I support that, and I've been encouraging for the last 2 or 3 years now an increase in funding of the Polk County healthcare, and the Polk County Health Department, excuse me, healthcare makes it sound like something else. The Polk County Health Department,
right.
Which is headed by Dr. Choe here, and so that's why we've asked him to be on the show this afternoon to really help us with that, since he is the director of the Polk County Health Department. So it really is very important to the people of Polk County.
You know, Dr. Choe, a lot of people may even be confused or have some misunderstandings or perceptions about what the role of the Florida Department of Health in Polk County is. Maybe you can kind of give us some of your focus and some of your mission.
That's a good question. The thing about what we do in the health department, a lot of people don't realize it. We do a number of services, and when people think about public health, they really sometimes only think of vaccines and diseases, but we do a number of things. We do things like conducting community health assessments. We want to figure out how healthy the community is. We want to see what programs are working or what we need to improve upon. We do things like monitoring incidents and outbreaks of diseases in the county. We want to see we're in the middle of flu season, so we monitor if it's how widespread it is, and if there's a lot of hospitalizations. And we also provide healthcare services in Polk County, especially to the people that may not otherwise be able to receive that healthcare. We provide primary care services in a number of our sites, as well as dental care.
That's a big thing that you're talking about here, because I was just looking at some numbers, and I'm not going to give them to you off the top of my head, but in terms of, like, for dental care, there's Polk County, there's a lot of people in Polk County that don't have access to dental care. And when you start talking about the low income or the indigent, you know, that's very important. Sometimes we think dental is the secondary, but that's sometimes primary, isn't it? Because it can lead to all sorts of other poor health in a person's life.
Absolutely. Dental health isn't just about appearance. There's a nutrition component. If you can't chew or break down the food, you can't get the nutrients in your body. And on top of it, it can be life-saving. Two of our dentists worked recently on a case on a client and found oral cancer, and they were able to refer them to oncology and provide the kind of treatment. So again, good dental care can be life-saving. And as you mentioned, there is a huge need for both medical and dental health in the community. In 2014, the Robert Wood Johnson Foundation released the county health rankings, and they found that Polk County was lacking in both medical and dental providers per population compared to the state. And in terms of and if that's the case and they don't have those type of access points, and they use, unfortunately, the emergency rooms for that kind of care. Speaking of dental, they found in a study in 2012 that 7,700 Polk County residents use the emergency rooms for their dental care. These are cares that could have been taken care of in a dental office or dental clinic, and obviously in an emergency room there's a huge cost associated with it, and they estimated in that study it was about $8.2 million that year.
And when you look at being inefficient, that's a great way to be inefficient, just running to the emergency room for things that could be taken care of. And I know funds are limited. There's only an X amount of funds, so we have to make sure we're good stewards of that money. So people just running, I guess, to the emergency room, Commissioner, that's not exactly a wise plan, is it?
Absolutely not. Number one, it takes up, emergency room assets that to be used for other people, and is a tremendous expense both to the provider and to the general public's budget. One of the things, Dr. Choe, I want you to mention too, is to talk about the inspections that you do. I know don't you do the restaurant inspections?
Oh, absolutely.
And then going the full route there, septic tank inspections that are extremely important.
Right, and just to even take it a step further, for the Florida Department of Health, we have over 400 public health specialists, and they're comprised of doctors, nurses, healthcare support technicians, nutritionists, as well as environmental health inspectors. We mentioned septic tanks. We have one of the largest septic tank systems in the state of Florida, so we need people to help permit and inspect those new septic tank programs, as well as repairs on those septic tank programs. And in terms of the food outbreaks, we work with other bureaus to inspect any type of food outbreaks and maintain that the food and drinking water are safe here in the county.
I'm just guessing a lot of people might not be aware that the Florida Department of Health here in Polk County was involved with that aspect of your health, so that's kind of interesting. We're going to take a very short break, but when we come back, we're going to continue our discussion with Commissioner Smith and Dr. Choe about health care here in Polk County. So stay with us as the Commissioner's Report. We'll be right back.